So unconscious, blue, not breathing. Yeah? Take your defib out. Turn it on. Some you have to turn on. Some they'll turn on themselves. Listen to what it has to say.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Bare chest. So do I have to strip them? I do. Have you got scissors? You have. Can you do that? Of course you can. Yeah. Strip the clothing off. Quick as you can. Then we're looking for other considerations on here. What we're looking for. What if you've got a bra on? Does it have to come off? Yeah, there might be wire in it. So does it have to come off? It does. Snip it off, pull it down, whatever you have to do, but it has to come off. There's no two ways about it. Anything else? Piercings? Okay, so what, like what? Nipple piercings? Nipple piercings, do they have to come off? They don't. They're not in the way. You'll see in a minute, they're not in the way. Yeah, and it'd take too long, wouldn't it? Yeah? Sorry, not below now, not below. Yeah? Take far too long. Anything else? Any other considerations? Pacemakers are placed on the left side in hospitals. These pads go on the right side. Yeah? On the odd occasion, a pacemaker may be placed slightly over to the right side, on the odd occasion, because they do. We can place the pads on the front and on the back, so they're not as anywhere near. Anything else? Any other considerations? What if they were wet and sweaty? Yeah, the pads might not stick. Do you have to dry them? We do. Yeah, have to dry them. Anything else? What if they're very hairy? Do you have to shave them? You do. You have to shave them. Of course you have to shave them, but you only shave them in the place where the pads go. You don't have to shave the whole body, you're there all day. Yeah, literally, not a long time. Yeah. Anything else? What else? What about patches? Smoking cessation patches, HRT patches, weight loss patches, morphine patches, glycerine patches. Yeah, usually placed here, or around here, but some people put them on the chest. Do they have to come off? They do. They have to come off. Yeah. There's a specific patch called glycerine. Yeah. What's that for? Angina. Yeah. What comes before glycerine? What's the word that comes before glycerine? Nitro. Glycerine. What's that? An explosive. What's this? A charge. Please take all the patches off. Just take every patch that you can possibly count. There is more and more consideration, yeah, but we'll come to it in a minute. All right, so listen to what it has to say, and then do what it says.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
It shows you where to pull it, yeah? Put them, sorry. So one goes here, one goes here.
Apply pads. Plug in connector.
Yeah? You see? Arcs across and back again. Hearts here, shocks, yeah? Straight across the body. There. Plug it in.
Apply pads. Plug in connector.
Plug in.
Analyzing heart rhythm.
Analysing.
Do not touch the patient.
If I'm touching them, who's it going to analyse? Me. So don't touch.
Shock advised.
Shock advised.
Charging.
Heart's in fibrillation.
Stay clear of patient.
Stay clear, stand back.
Deliver shock now. Press the orange button now.
You can see where you need to press it. Is that a good position for the defib? I'm just going to press it. Where's my hand?
Deliver shock now. Press the orange button.
Is that a good position?
Shock delivered.
Shock delivered.
Go. Start CPR.
Yeah. You don't have to wait for it to say start signal, it'll just get up as soon as it's shocked. And then it might shock again. It might analyse again and shock again. And again, and again. Reece Mwamba, the Bolton Wanderers player, 15 times it was shocked. Ericsson, once. Depends, all depends. Yeah? Any questions? There's a consideration for this one here. Anybody know what it is? If you lie down, if somebody lies down on their back, yeah, and the breasts fall to one side, yeah, can you put this over the top of the breast? It won't make a proper connection. So you have to move the breast out of the way and then put it on. So be aware of that. Yeah. Okay. Any questions?